On Tuesday, Director Dixon announced 2 new recovery programs for Missouri businesses. And today, we are excited to share even more good news. According to the June jobs report released today, Missouri's unemployment dropped more than 2 full percentage points from 10.1% in May to 7.9% in June. This is great news for our economy and shows that Missourians are getting back to work. Over the month of June, unemployment increased by 71,000 jobs, with substantial increases in both goods-producing and service-producing industries. Combining both May and June, Missouri recovered approximately 1/3 of the jobs lost in March and April. We are very encouraged by these numbers, and we will continue to do everything we can to rebuild our economy and help Missouri families, businesses, and communities recover from this crisis. One sector of Missouri's economy that was hit especially hard by COVID-19 is tourism. From our cities to our rural communities, tourism in Missouri has a huge economic impact on our state. Since COVID-19 hit in March, tourism activity and spending has dropped significantly, forcing many tourist attractions to close or reduce workforce operations. Today, we are excited to announce a new $15 million program to help the tourism industry recover. Director Dixon and Missouri Tourism Director Stephen Fountz are here today to share some more details. Director Dixon.
Thank you, Governor. As you just heard from the Governor, this morning's job report is certainly a positive sign, but we do have a ways to go, as we've talked in recent days in particular. The tourism hospitality industries have been particularly hit hard during the pandemic, leaving communities that depend on this sector on both the public health and the economic impact side still struggling. We know that more than 40% of American travelers now say that they have no plans to travel for the rest of the year. And as a result, many attractions like theme parks, museums, and restaurants had to alter their operations significantly or were closed during the spring, which is certainly an important travel season for our state. Those changes and closures impacted employment for tens of thousands of Missourians, when the food service industry alone seeing more than 58,000 unemployment claims between March 15th and June 27th. So we know it will take some time and investment for our tourism economy to recover, and that's why we've developed these programs that the Governor just mentioned. On the front lines of the effort across the state is the Missouri Division of Tourism. You'll hear from Stephen Fountz in a moment, and certainly our local Convention and Visitor Bureau partners across Missouri. And while they're working diligently to promote and rebuild our state's tourism industry, they've also met the challenges on their own as a result of COVID-19. But thanks to the leadership of the Governor, Lieutenant Governor, and the Missouri Tourism Commission, I'm so glad that we can bring home so much of this needed relief to this industry and to these organizations. Missouri is certainly blessed with many attractions and activities that visitors can enjoy safely if they take the right precautions. And the funding that the Governor just announced, $15 million in CARES Act funding, will certainly help our state's tourism industry make these attractions safer, as well as reinforce messaging to encourage visitors to come to Missouri and safely enjoy all there is to see and do in our state. So many Missouri destinations and businesses are working hard to stay open, to support the countless jobs that depend on this industry while protecting the safety of their workers and their customers. A key to doing this is giving consumers the confidence that businesses are doing what they can to protect customers and workers. That's why today we're also launching a program called the Show Me Pledge. This will allow citizens and businesses to display their commitment to mitigating the spread of COVID-19 by taking a series of common sense measures. This includes precautions that businesses can take to protect employees and customers at their place of business, and it also includes items that citizens can do on their own. But as we've discussed earlier this week, it certainly has not been easy for businesses across Missouri to rapidly shift their operations and to implement new measures to keep everyone safe. There are resources that are available, though, and many agencies at the federal, state, and local level, as well as other organizations, have programs that can assist frankly to the point that it can be overwhelming sometimes for those folks to know where to start. So we've included on our website a business recovery lab to point them in the right direction. And this pulls together industry-specific resources, data, and best practices, really all in one place to help them navigate the challenges brought on by COVID-19. If folks have not done so yet, we strongly encourage them to go to showmestrong.mo.gov to check out these resources, including the grant programs we announced earlier this week, as well as the tourism funding program that we're talking about today. And you can also take the Show Me Pledge for yourself. Again, that's showmestrong.mo.gov. Now, here to tell us a little bit more about the CARES Act funding program for tourism is the Missouri Division of Tourism Director, Stephen Fountz. Stephen?
Thank you, Director Dixon. Thank you, Governor Parson, for allowing me the chance to speak to this group today and for this important program that we are announcing. The $15 million program for DMOs represents a significant investment in the travel industry, which I believe will play a significant role in Missouri's economic recovery. This support is crucial because travel is a key component of the state's economy, with direct travel-related spending in Missouri topping the $14 billion mark in fiscal year 19. The COVID-19 public health emergency forced DMOs, destination marketing organizations, to realign their operations by implementing workforce reductions and telework strategies. It redirected their funds away from their core mission of marketing, as advertising dollars were used for operational efforts. Missouri's success in the travel economy is bolstered by the incredibly talented people who work within the industry and whose marketing campaigns inspire consumers and highlight all the wonderful things there are to see and do here in the Show Me State. Those partners produce marketing campaigns that generate what we call incremental visitation and incremental spending that tops in the billions of dollars. Those are trips and spending that would not happen if it were not for those DMOs and their marketing efforts. The Division of Tourism is fortunate to be able to work with more than 40 such partners that are focused on sharing Missouri with the rest of the world. The program announced today helps ensure those partners are able to maintain their marketing focus, include messaging on safety measures that have been implemented by their attractions and other tourism assets, and that they'll be able to address some of the operational issues related to the COVID-19 response. Another major component of this program focuses on enhanced safety efforts for events. Qualified DMOs can apply to have costs associated with things such as temperature screenings at events or event facilities offset through this program. And while we've seen a slow and steady increase in leisure travel since the economy reopened in May, the return of convention and event business has been significantly impacted and remains almost non-existent in many communities. Conventions and events are vital to the lodging industry and to the communities that host them, as attendees spend time dining, exploring, and shopping in and around the host cities. These activities are particularly important during Missouri's shoulder season, when leisure travel traditionally slows and lodging businesses count on convention attendees to fill hotel rooms and utilize other services. More of that activity is vital to Missouri's economy, and having screening measures in place offers the opportunity for the Show Me State to boost the confidence of planners who are considering when and where to host their events. Along with marketing and safety equipment, this program allows some DMOs to qualify for payroll support. This section of the grant program may be a benefit to those DMOs that were not qualified to participate in other federal programs because of their organizational status. Overall, these funds will help ensure DMOs can continue their work and maintain their staffing during the health emergency. We'll be sharing full program details with our DMO partners in the days ahead and look forward to working with them as they seek to help reinvigorate Missouri's economy and connect with consumers who are ready to safely explore the Show Me State and all the great things we have to offer. Thank you.
Thank you, directors, both of you. As we know, there's many things contribute to the economy in the state, including tourism. You hear today with all the other things going on. It's still people need to get out and enjoy life a little bit. And the one thing I think I want to encourage right now for all Missourians, as we said before, there's a great opportunity to support Missouri businesses through tourism. And if there's ever a time to support our local communities, now's the time to do that. And tourism is one of those ways we can do that. So as we know, people are going to be reluctant, still reluctant some to travel. but we do think in the days to come that hopefully they'll spend some time in Missouri, what we have to offer here on that. Dr. Williams is also here back to answer your questions here shortly, but wrapping things up for this week, I will be back in Southwest Missouri tomorrow. Next week, we will travel across the state to talk about violent crime and to thank the law enforcement officers for what they are doing across the state. We will be back on Wednesday of next week, and we will have only one briefing next week due to traveling across the state in many of the areas that we'll have an opportunity to meet with the media. So with that, I hope everyone has a good and safe weekend. Please remember that COVID is still here, but we can protect ourselves. Social distancing, wear a mask, wash your hands, and we are not defenseless against this virus, and we will get through this. Thank you, and God bless. Kelly?
All right, thank you, Governor. Director Dixon and Director Fountz. Brian?
Yes, Director Dixon and/or Director Fountz, whoever can answer this. The tourism impact, do either of you have any numbers or general statistics on the impact that COVID has had on the Branson area specifically and also Lake of the Ozarks? Thanks.
Certainly on the Branson area, Taney County in particular, we have looked at not just from specifically related to tourism, but also to kind of the economic and social impacts of COVID-19. And as we've talked all along, COVID-19's effects, both economic and public health, really are two sides of that same coin, and we've certainly seen that in Stone County and Taney County in particular. We've seen early on that, in particular, higher unemployment rates and things like that than the rest of the state, and that kind of follows trends around the world, around the country in particular, of where those effects are seen. So yes, Brian, to answer your question, we are seeing disproportionate effects on it, and that's why today's announcement of this new tourism grant program is so important to help our state's tourism economy recover, because those parts of our state in particular have been hardest hit. So thank you.
Crystal?
So a couple of months ago during Memorial Day weekend, there were a lot of tourists in Lake of the Ozark, and that stirred a lot of consternation about partying and about how that shouldn't happen during a pandemic. Is Missouri shifting towards inviting people from outside the state back into the state during a pandemic?
What we've talked about from day one is that citizens have to take responsibility for their own action. That's why, frankly, we just launched the Show Me Pledge program and provided additional resources and information. There are ways to go about doing business safely. The governor just talked about some of those: social distancing, wearing a mask, being, hand sanitizers and washing your hands, all of the things that public health officials have been talking about from day one here. So if folks do those kind of things, they will be able to go about resuming economic and social activity across the state safely. There are ways to do it safely. We've put information out there about that. And so when we're talking about reviving our state's tourism economy, as we've talked about, the virus is still here. The governor just mentioned it a few minutes ago. The virus is still here. We have to go about resuming economic and social activity in a safe way, and that's really what we've been talking about all along. So there's nothing is shifting here, Crystal.
And just, you said that those dollars will be shifted towards marketing. So what would a marketing pitch for tourists sound like during a pandemic?
Well, I think, again, it would emphasize the opportunities that are here in our state, certainly, but it would emphasize how you can go about doing that safely. And that's really what we've talked about all along, is that this is a new normal for the world economy. It's a new normal for our state's economy, and we're going to have to go about doing business with the virus around us. And so as you talk about why somebody should come to our state, why somebody should want to do business here, whether it's for tourism or other reasons, they want to know that you can do so safely in Missouri, and that's what this is really all about.
Hi, Director Dixon. I know you said the tourism has been impacted heavily. Do you have any specific numbers you can share with us about how much the coronavirus has impacted tourism in our state?
I can provide you some more specific numbers. We know that in Q3 of fiscal year 20, we saw a decline in tourism-related spending of around $300 million just in that quarter. So I can get you some more specific numbers after this if you'd like.
And then, One more quick question. How are you going to decide which communities get that $15 million spending?
Sure. So as part of the grant program, one of the qualifiers is that the DMOs need to have participated in our division's cooperative marketing grant program during the last 2 years. And so we have a pretty good handle on the number of applicants that we will see with that parameter in place.
Director Fountz, I think this may be a good question for you. Thinking about hotels, we've seen some stark numbers of hotel stays going down. Is your department giving any guidance on how hotels should be handling this crisis right now, or giving your DMOs any, what kind of guidance are you telling hotels right now that are seeing these low numbers?
Sure. So a lot of the hotel properties, the lodging properties in Missouri, as you're well aware, are associated with a brand. And so they rely on that brand to provide them with health and safety guidance specific to again, that brand. Also, there are groups like the Missouri Hotel and Lodging Association that provides support for the lodging industry, and then the American Lodging Association as well, or American Hotel and Lodging Association as well. And the national group has put out some guidelines for all hotel properties to consider.
Director Dixon, I believe this question is for you. I just didn't know if that $15 million was broken down by a certain numbers going to payroll, a certain numbers going to marketing, a certain numbers going to relief for the DMOs. Is there anything like that, or is it just $15 million and you guys are separating it as the grants come in?
No, the guidelines will be published later this week. And again, as Stephen mentioned, there's a limited population of organizations that participate in the state's cooperative grant marketing program. And depending on some of those specifics is how that would be allocated, certainly.
Are there any specific attractions in mind with this money, or is it more letting DMOs kind of decide how to market their areas?
Yeah, it's based on the community itself, the destination themselves, and then obviously there are a variety of attractions that are in those communities, and so that's why we're using the model of the state's cooperative marketing program as kind of the backbone for that.
And then is there any plan at this point for places like theaters, music venues, local venues like that?
So this program itself is designed for those tourism support organizations that are designated as a destination marketing organization. Earlier this week, if you remember, the governor announced $50 million in additional small business and other types of business support programs. So we just rolled out earlier this week a small business grant program that those organizations could apply directly to. The program that we're talking about today is for the tourism support organizations like a destination marketing organization. So just a fine point there, but we already have that information on our website, and if they want to go and apply for the small business grant program, if they qualify for that, we'd be happy to work with them on that as well.
All right, thank you, Director Dixon and Director Fountz. Dr. Williams?
Thank you, Kelly. If I could just follow up on one thing. As you talk about going into the weekend and you talked about tourism, one thing I would really emphasize is we have such a beautiful state outdoors. And so what we would love to see people do is to, wherever they are in Missouri or wherever, to take advantage of just our beautiful natural settings. I get up every morning and run on the Katy Trail. I saw a family this morning of parents and a daughter riding their bikes. And so I think as you talk about tourism and things to do, this is a wonderful time. It's easy to social distance on the Katy Trail, I can tell you that. You don't have to use hand sanitizer. There's nobody there. And you don't have to wear a mask because there's nobody out there either. But if you are outdoors in a park or something like that, and there are people, then we very much want to reiterate that message of use hand sanitizer and clearly social distance. And if you can't wear a mask today, we're going to go with the University of Missouri, the Tigers. That matches my tie. I had the privilege of teaching a course over there. So especially for our young people, as we go into the weekend, I would greatly appreciate your help in the media reinforcing the message that if you're not going to be outdoors, or if you're going to be outdoors in a pool or wherever, you've just got to social distance and you've got to use hand sanitizer. And if you're not going to be able to social distance, wear a mask. I think I mentioned earlier in the week, we have people, when we do case contacts, that are infecting 9 and 15 people in those type of settings when they don't do that. So greatly appreciate your help in getting that message out. Other thing I just want to add real quickly, there are a lot of wonderful health department leaders in our state. They have the names of Sylvia and Pam and Lisa and Clay and Rex and others, but just highly encourages the governor has. The governor's team did such a phenomenal job of getting that CARES Act money out in 10 days. And here we are yet, we're in July, and when I talk to local health departments, they still haven't received some of that money to do contact tracing and testing and PPE. And it's got to be spent on COVID. So they've asked me to be their messenger, and I certainly am very willing to do that, is we really would encourage our county commissioners to be really robust in helping our local health departments get that money out. Sorry, Kelly, happy to answer your questions.
Hi, Dr. Williams. Sorry, hiding behind the camera here. Okay. I'm going to read from my notes. I do have some numbers, but I saw an email that was sent to some local health departments a couple days ago that indicates that DHSS has a backlog of 7,000 potential COVID cases. Now, I do realize that this may include some duplicate records.
Yes.
But do you need more staff to get rid of that backlog? And has that backlog affected the positivity rate?
No, the answer to your question is that is accurate. I just left a meeting 2 hours ago in which that exact number was used. What we're doing is we've been using the National Guard, we've been using other people, but we are ramping up other people in DHSS to become contact tracers and to do that. Well, not to do the filing of that information. So it's not something where you can just, as it was mentioned to me, it's not, they're called processors. It's a process to go through and enter that data. And so right now we have about a 4-day backlog. That equals 7,000 tests. And as hard as we can, we are training other people in DHSS to do that job. Now, it's something important to emphasize that we have a rule in DHSS. If we get a positive, we report that out in an hour. I've insisted on that because I want our local health departments to know within an hour they've got a positive, because that can make a difference. But as it comes into putting it into the processing and putting it into the computer, we're running about 4 days behind at 7,000. Our positivity rate remains low. Our 7-day rolling average, I looked at it today, it's about 3%. And so we're, that's very good. You want it under 10 and love to have it under 5, and we're about 3% for our overall positivity rate. So in a long-winded way, I would just tell you that the 700 doesn't affect a 7-day rolling average of 70,000 tests. Sorry to make that so long.
No, thank you for the information. I also was speaking to some state employees who informed me that a state employee had tested positive for COVID earlier this month, and they had possibly been exposed to this individual in a DHSS meeting where there was very little social distancing or no masks. Are there any extra precautions as we're seeing cases continue to rise?
Well, we're pretty clear on this for our state employees, and Sarah's done a great job working with us and communicating that, is that we, again, emphasize the 3 things, and we leave it up to each building and each department. I had this conversation today with my team, is that certainly each building or each person who knows the job responsibilities, just like our local health departments, has the capacity to do more, if that makes sense. And so we leave that up to people who know, in other words, if you're going to be in Department of Revenue handing out license plates and be constantly working with people, then you ought to wear a mask. So our message, again, as Rob said, has been pretty consistent on that, is that use those 3 fundamental public health prevention measures, but for certain job situations, you may need to even do that more, for instance, wearing a mask all the time.
Hello, Dr. Williams.
Good afternoon.
With cases continuing to rise in Missouri and this new tourism plan announced today, is the DHSS worried about tourists coming to Missouri and potentially infecting other Missourians?
I think no matter where you're from, if you're one of our areas that has a higher incidence or you're from another state, we just really, really want to emphasize that if you use good hand washing and use social distance, and if you can't social distance, you use a face mask, we feel really good in that. As the governor said, we are not powerless against this. We've learned more. What we're telling people is different than back in March. And so I feel very comfortable telling people it's okay to come if you'll do those 3 things. Now, if you're not going to do those 3 things, then I don't feel as comfortable telling you that. But if you'll do those 3 things, And I want to just, again, emphasize, I always use an example of exercise. I exercise every day. There's a risk to that. I could blow out my knee, tear my ACL, but I think exercise is good for me. I think it's good for my health. I think it's good for my wellness. So, I come from a background of risk and benefits, and I think there are benefits to getting outdoors, to travel in that case. And are there some risks? There probably are, but there are also some benefits. So let's not lose sight of that exercise and getting outdoors is important.
Now we're going to take two more. Crystal and Philip.
Hi, Dr. Williams.
Hey, Crystal again.
So just turning that question on its head, so as a health professional, do you recommend that Missourians travel now during the pandemic out of the state or to indoor attractions? Because you mentioned outdoor attractions, but right now the emphasis is on indoor attractions.
Yes, I certainly do. I think, again, if you'll do those three things and do those purposely, I think it's fine to both travel and it's fine to do indoor activities if you do those three things.
And does, you mentioned contact tracing. Does DHSS currently have a vendor for contact tracing? And if so, how many people are currently in DHSS working on it?
Well, again, we have a hybrid model as we've talked about, and I misspoke earlier when I said contact tracer. I really meant processors for the information for our positive cases. And so in our hybrid model, we work with the local health departments to provide them one. But again, we really encourage our local county commissioners to free up that funding to give them more capacity to do contact tracing. And then the other thing we're doing, Crystal, is we are working with a vendor on software, which we think will be a great help to them. And I think we'll be releasing more details on that shortly, I believe.
All right, Philip, thank you.
Hey, Philip.
Obviously, at a meat plant or a long-term care facility, people come in and they stay there for a long period of time. But do you have experience doing testing at a place like the Capitol during special session where people are coming and going all the time?
It's a good question. I'm trying to think. To your point, we have experience with long-term care facilities, camps, meat packing plants, but kind of events like that. What we do in those cases is look around the country and see what's going on. As you know, there's a special legislative session coming up. So that's what we've in fact been doing. We've been looking at what they've done in other states. We talked to the CDC about it, and I think you'll hear us roll out what our thoughts are on that particular thing shortly, and also just those type of events. Another one that comes to mind is the state fair. So I would tell you that our strategy in all of these always is on the front end to prevent as much as we can, whether that's by screening or asking questions, but it always comes back on the other end to box in, to have the ability to very quickly identify, whether it's at the legislature or at the state fair or wherever, to identify a case and very quickly box it in. So thank y'all.
Thank you. Governor Parson.
Yes, good afternoon, Governor. Two-part question on the special session call for the violent crime. Number one, do you have a time frame about how long you think that would take? Is it a matter of days, weeks, et cetera, if you could elaborate on that? And two, the Legislative Black Caucus Chairman, Representative Stephen Roberts, has called for you to add police reform to that. Any intention of doing that? Thank you.
Sure. Yeah. First of all, we're going to try to get it done in a narrow time frame as we can. So one, we'll be talking, matter of fact, when I get out here today, I'll be talking to some of the legislatures this afternoon, trying to really narrow the scope of special session. One, just because of the situation we're in. Two, we don't want to be in here any longer than we have to be to do that. So hopefully they're going to be prepared. They're going to know exactly what the call is, and hopefully they'll be able to take up those bills as soon as possible, both changes. Keep in mind, too, the legislatures, we won't need everybody in here every day until it comes time to vote, unless you're on some of those committees. So there's things we can do to limit the flow, but of course that'll be up to both chambers, be up to the House and the Senate. The second part of the question, there'll be lots of people calling saying, hey, would you add this to the call? Would you do this? And I know reform's out there, but reform's not going to be something that's going to be easily done in a short session. One, there's a lot of things that's going to have to go a lot of work in that to see what that looks like. whether it's in St. Louis, whether it's in Kansas City, or whether it's statewide. There's a lot of discussion we'll go into it, and that needs to take place at some point. I really feel like the best place to do that would be in a legislative session where you can have lengthy committee hearings where people can be in there and have an opportunity. The only reason I am calling this special session is for violent crime because of the homicide rates in this state. That's the whole entire purpose of that. And I do realize other people will have different things they would like to do, but at some point you've got to narrow it down to the real issue at hand. And I think right now it is the homicides in the state of Missouri.
Crystal.
Governor, one of the key pieces of the your call for legislators to come back is to work on a witness protection and relocation program. Does it concern you that even if that program is passed, there isn't any money set aside for it in the budget that is already completed?
Yeah, we're going to find ways to fund it. We'll find other ways to fund it. One of the things we're planning on doing is funding that program in a limited source, wherever we got some other things we're looking at right now to find the sources to do that.
Are we talking about like grants or moving money around in departments?
Oh, yeah. You know, I've got a staff that takes care of that. I said, hey, we're going to go out here, we're going to find the money somewhere, and they'll find the money, and then we'll let you know where that money came from when the time comes. But I think it's really important. I think you've got the witness side of it. I think you got the mental health side of it. I think there's different sources. There's VOCA funds out there. There's different things. But we're going to be looking wherever we can to find the funding to support these, and we plan on doing that.
Governor Parson, earlier today you tweeted about the former pharmacist Robert Courtney. I don't know if you can mention your thoughts on Robert Courtney and him being out of jail early, and just elaborate a little bit more on your tweet, please.
Yeah, I'll be fine to. I'll even probably do it on a personal scale. That's a sick guy. He doesn't need to be back out in society for what he did to hundreds, if not thousands, of people in this state, in the Kansas City region, and he needs to be accountable for those actions. Period. And he doesn't need to be back out on the streets. All right.
Thank you.
Thanks everybody for being here. Have a good weekend. Thank you.